The role and responsibility of community and public health officials. Content: the public, the population, and the role of the community in public health programs. Public health organization structures and how allocated funding is managed. Dimensions of community and public health services: are they considered rights or privileges? Rights or privileges? That is the controversial issue concerning healthcare in the U.S. Health issues found in a community of lower socioeconomically status as well as communities of higher economic statuses can be determined whether poverty is a cause of poor health in a community or whether poor health is the cause of poverty. Using epidemiology measures that can provide a passive surveillance of insights on data information concerning both infections and chronic diseases, how they are developed and treated, has been most challenging for many healthcare agencies. Studies have indicated that chronic diseases are leading causes of morbidity, physical disabilities, and mortalities in the United States. They have also indicated that foodborne illnesses and airborne illnesses are considered to be contributing factors to many of the infectious diseases treated by the Department of Health Services. Many chronic diseases in the population faces the many chronic diseases that the population faces are coronary heart disease, malignant neoplasm, chronic lower respiratory diseases, Alzheimer's, and diabetes mellitus. Many healthcare agencies and those of the population feel that healthcare is a privilege because of the many epidemiology studies that have been reported due to food and airborne contaminations. No one can really estimate or predict how those affected will conduct themselves in such outbreaks. Researchers have indicated that using reciprocity core measures have been used to understand ethical behaviors thus far. Preparedness, responsiveness, planning, and trying to predict how citizens will behave in a particular way has yet to be determined. Organizations that support community and public health can be assisted through federal government agencies, non-governmental agencies, and various other international organizations. Known agencies are the USDHHS, the Environment Protection Agency, the Institution of Medicine, and the World Health Organization, all of which use requirements that implement and recommend to protect the population through both distributive and global necessities. The Center for Economic and Social Rights was established in 1993. It was used to promote social justice through human rights in a world where poverty and inequality deprive communities of dignity and even life itself. Housing, education, health, and health environments, food, work, and an adequate standard of living. Many feel that this system value profits over people with this frame of thinking. And healthcare has spiraled out of control for the American population. The CESR indicated that the rights to health is a enshrined international legal instrument. Various may various many were drafted in U.S. leadership, such as the Universal Declaration of Human Rights and the International Covenant of Economic, Social, and Cultural Rights. Studies have indicated that the government are obliged to enforce human rights to health are categorized in three ways that are respect, protect, and fulfill. Respect, a government itself must not to violate the right to health, as it would be cutting funding for doctors who are underserved, who work in underserved areas. To protect, a government is responsible for preventing third parties from violating the rights to health. And fulfill, the government must assure all citizens have access to basic health services. In contrast to the additional emphasis of bioethics on the physician and patient relationship, public health ethics focuses on the design and implementation of measures to monitor and to improve the health of populations. In addition, public health ethics look beyond health care to consider the structure conditions that promotes the habit of the development in health society. Healthy society.